I was influenced to go into nursing at an early age because my mom was an ER nurse for 30 years and she raised 5 kids as a single mom on a 1 income, and I saw her leaving the house and taking care of other people, and that's what I wanted to do. There's a lot about my goals that were set early because of watching her. She was a really good example of how to be kind. She showed every patient kindness and compassion, and that's what I wanted to do. And I've always been drawn to other people and making those human connections, and nursing just made sense. And so that's what influenced me to become a DNP. My role at RAMC in the walk-in clinic blends 2 of the worlds that I've had professional experience and exposure to, which is primary care and emergency medicine. And my background includes both of those areas, and it allows me to get higher acuity patients and to deal with things as they arise. As you know, not every emergency or issue for healthcare happens between 8 and 4, Monday through Friday. So the walk-in clinic is a great bridge for that. If you are having trouble getting into your primary care provider, or your ear infection that comes on after hours, all of those things can be addressed in walk-in, and it gives us a really good variety and keeps things exciting. I don't always know what to plan on, what's coming through the door, but I do have the chance to slow the pace down and spend time with the patient at the bedside and address the problem, whether it's geared more towards family practice or emergency or urgent care. What I find the most rewarding about what I do is I can make a difference in just a few seconds with a person, make that human connection with them, and just get at eye level and see what I can do. I may not have all the answers or the solution immediately, but I can come up with a plan, and I can let the patient know that's in front of me that I care and that we're going to work on this together and try to come up with a solution that works for the patient to improve their health care. And that is my why. That's why I do what I do. I chose RAMC because it offers rural health care. Where I come from and what I'm accustomed to in healthcare is there were things that were lacking 10, 20 years ago, and part of what brought me to RAMC is to bring those resources, that professionalism and that expertise to every corner of the countryside. And I want our patients to have access to that and not have to live in a large metropolis or big city. This is where we need to do it. This is where our families are, and that's why I chose RAMC. Outside of work, I spend a lot of time with family and friends. I try to go running as many days a week as I can. Otherwise, my dog doesn't speak to me for a while. She goes with me. And I also do some jiu-jitsu a couple times a week just for a challenge. It was something that I was always interested in. I bike, I do yoga, and I find time to spend outdoors in the sunshine. I try every day. As you know, Wisconsin weather doesn't always cooperate, but there's sunshine in every day, so just gotta find it, and those are things that I enjoy.